بسم الله والصلاة والسلام على رسول الله وعلى آله أجمعين. Assalamu alaikum, brothers and sisters. We welcome you again to this Liverpool Ramadan program. And today, inshallah, we have the honor of hosting Dr. Abdurrahman. And inshallah, today he will be speaking about your health during this pandemic, inshallah. And Dr. Abdurrahman is an ENT consultant in Mid Cheshire Hospital. And inshallah, he will give us this talk about how we can keep healthy during this pandemic. And if anyone has any questions, please put it in the chat below, please. And I'll give it over to Dr. Abdurrahman. تفضل دكتور.
السلام عليكم. طبتم وطاب من ممشاكم وتبوأتم من الجنة منزلا. السلام عليكم, all my brothers. Today I'll mix the lecture between Arabic and English. It's mainly about the most common questions that people ask during this pandemic. You know that all of us are a bit concerned about the health issues, especially during Ramadan and the COVID-19 crisis as well. So there is a common question usually that being asked to the WHO or to the NHS website. So we will go through those questions and it will give us a bit of idea about whether we know much or we don't know much about the COVID-19 protections, the risk, how's the patient presented, what is the severity, am I in the high risk group or the low risk group? All of these questions can be answered as well. How to protect, what is the best, if there is a specific treatment, what about the vaccine as well. Just the Dr. Suhaib as well was just mentioning that the Boris Johnson was just announced that the R factor has been decreased to below 1. So just what is the R factor? Is this important? Is this give us a bit of idea how things is going? Yeah. So I'm gonna start with the Alhamdulillah wa salatu wa salam ala Rasulullah. So all of us knows that the COVID-19 it's a SARS-2 virus infection that can spread through the droplet infection. So that means it's through the all of the things comes out your nose, the throat, through coughing, spitting out. So this is the main transmitter of the transmission way of the viruses. In terms of how's the severity of the disease. So the severity of the disease and what is the symptoms. All of us knows that the cough and the fever are the main symptoms, but there is other symptoms that comes with. The severity of the disease depend on the general health issues. Are you fit and well, or you have some other chronic diseases or things that can affect your general health, like age, diabetes, blood pressure, problems, heart conditions. So it's vary from the mild symptoms, which is the fever, cough, a bit of a respiratory distress, which is the inability to breathe a bit better, and also to the severity of starting to have one of the organ failure. So it started with the respiratory failure, that means you can't breathe well, and then may progress to other organ failures, and depends on how's the your general condition to pass to this. May Allah save us, all of us, from this conditions. The main question was, is there asymptomatic people? Yes, there is asymptomatic people. So there is a carrier, but a person who's carrying the virus, but he doesn't have symptoms. They are not the highest. We don't have any statistics up to now, because there is no such swapping or testing for everyone. So we can know but there is in some of the territories in Germany, they have done this, like the Bavarias, and they found that there is up to 10 to 20% of the people that who have been tested, they are positive, or they have the virus, but they don't have these symptoms. Those people are infective. That means they can transmit the virus. The WHO have just answered the main way of the disease spreading is through the respiratory droplets. So that means that the spitting, the coughing, these are the main ways. So the risk of catching a COVID-19 from someone with no symptoms at all is very low, but still it is, especially if he doesn't have a good hygiene, spit on the floor, spit on any surface. If you catch this surface, yes, you can catch the disease. The other question, which is the common question, it's a droplet infection. Does touching the surface can cause the disease? Yes, it's like the common cold. So the infections spread through the coughing, spitting, or sneezing. So if somebody sneezes, cough on the surface, yes, you can catch it. The question, how long this virus will stay on the surface, there's a lot of publications, a lot of researches, but all of those researches are in vitro. That means it's in the lab. It hasn't been tested in the real life. So they, for example, all of us have here that the virus stays for 7 days on the metal or 2 days on the wood. There is no such good evidence how long does the virus stay active, because we all know that the virus is not a living, it's a semi-living organism. So it's either active or inactive. Mean in terms of active, that means he can produce the disease, or inactive, that means he can't, or dying a virus. So how long? There is no such answer for it. The only answer that I've tried to search for you is the NHS Scotland that have been announced that the virus can stay from 24 hours to 48 hours on the surface upon the swabs and the studies that they have done in places like the hospital. But still, there is no such good researches. There is another one in Germany that have been also carried out on 110 person who have got the COVID-19, and they found that the virus is like inactive in the stool, but it's inactive meaning that cannot cause harm. They are present on all of this surface that the patient has touched, but not all of them has been actively present. So we don't know exactly but still touching things can transmit disease. The German study shows that the only 1.5% of the risk of getting the infection from touching the surface, but face to face it's up to 80%. So 80% of facing a coughing or a sneezing person with the symptoms, you may catch the disease. Also, who is the most risk for the coronavirus disease? All of us are at risk, all of us. But the problem is that the people who are vulnerable are highly at risk from the severity of the disease. So they have to just get extra precautions by staying safe away from contacting people and stay at home. There are another common questions that, because the people I know some people that who disinfect the food, so spray like a chlorine on the food because they thought that the food can transmit the virus. the NHS and the gov.uk have done a publication which said clearly there the COVID-19 is a respiratory illness. It is not known to be transmitted by exposure to the food or food packaging. Okay, but they announce as well that any person who works in food department or in factories, with the symptoms, they have to be kept away. But the virus does not spread through eating through the food products. Another common question is the virus is zoonotic. The WHO have mentioned that the coronavirus are zoonotic, mean that they can transmit through animals and people. So through the people and animal, because they announced previously that cats and dogs does not they don't have the symptoms of COVID, but they can be a carrier of the infection through a body carrier, which is their body, or through their salivas and things. Especially if he's coughing or if you have spitting or troubling. So just be careful if you have dogs, cats at home. I'm not saying that to get rid of the animals, but just be aware of that. He can be also the transmitter of the disease through a carrier. So he walks on the floor, he walks in the street as well. So he can be a carrier of a common carrier of the virus. Okay, so other questions. If you got the virus, what is the common time to taken through from catching the virus up to the recovery? So it's also the WHO that say that they have, upon the analysis of different researchers, they found that you may Allah save everyone, but usually the first presentation is the fever and the body ache, and then you started to get the cough on the third day. But there is an incubation period. That's mean that you got the virus, but you don't have any symptoms, which is around 2 to 5 to 6 days, and sometimes range to up to 14 days. Okay, so how long does the symptoms stay? In most of the cases, the symptoms stay for a week or two. If you pass the first week, it's unlikely to your case will be deteriorating and you get to the severe cases. But if you get the symptoms more than 10 days without any change, you have to be a bit conscious, especially if you're at home. You need to go to the hospital, because it's unlikely to stay for 10 days without any improvement. That means that you may get worse. So in terms of the recovery, the most recent publication shows that the recovery, it's up to 2 weeks. So up to 2 weeks in the mild cases, but in the severe cases, it may the recovery would take 8 to 9 weeks. So how any of our brothers who catch the disease, may Allah give them the shifa, they have to be aware, even the symptoms has been cleared out, to make sure that they're getting enough food, enough rest, because they are not fully recover until 2 weeks at least, if it's a mild, but if it's severe, it's up to 8 weeks. Another question about the using of the disinfectant. Okay, so the recommendation is to use the water and soap. So the first recommendation for the disinfection is to use the water and soap. But the second option is to use the alcohol and the alcohol gel, which is, I prefer the alcohol gel, but stay more than the alcohol itself. And the third one is using the chlorine, which we know there is a lot of chlorine composites, which is the bleach that we know, but this is highly concentrated, so you need to dilute it much to be used. And or the what's we know, like I'm not doing any advertising for products, but Dettol, for example, it's a benzyl components of chlorine. So it's a benzyl ring with a chlorine, so it's have a chlorine as well, so you can use it, and some of them are safe to be used, like the what's called the aluminum chlorine. So it's another product. It's not the Dettol, but it's all the chlorine. But it's the second option, or the third option, as the WHO have been announced. Okay, so again, back to the question, the common questions: does the mosquito bite transmit it, or any other flies? It's clear that it's not like the Ebola, or the malaria. The mosquito flies does not transmit the disease. Another common question: does the virus has any effects or is affected by any change of weather, like the hot or cold? No, it's clear. No, the weather or the snow or the sun does not kill the virus. Just to be clear about this, because some of the people have thought that when the summer comes, they will be more safer. No, it's what's happening now. It's just the something called the infectious cycle. So we in the first cycle of the infection. So just everyone have to keep the measures that he's doing it, despite that we have passing the peak and the R factors has decreased much, but still you need to keep safe and follow the instructions. Okay, so again, how we can stop the spread. If you applied all of the previous measurements, if you have done your best to keep the social distance, and cleaning yourself, your hand, if you use a mask, which is I know that the UK government not recommending using a mask, but there is another published German article through one of the professor of the health the health system there, of public health. He in his publication mentioned that the use of the mask, it decreased the spread of the infection upon his large population research. So how we treat the COVID patient. So it's clear, just to be to let you know, there is no definite treatment. I know that the new antivirus that have been used in the Ebola before have been mentioned through the Trump team health team, that the remdesivir is one of the anti-Ebola virus that has been used before, and whether it's an effective or not, it's still, there is a lot of trials that has been going around. So using the chloroquines, using antibiotics, using the anti-leukotriene, using this new antivirus, because everyone will hear about it, because the American is making sure around it. There is no such definite treatment for it. But still, we have, as I have mentioned before, if a mild case in the 7 days and you started to improve, it's alhamdulillah, this is a good sign. But if you started to deteriorate after this or staying the same, you need to be in the hospital, and then upon the trial or the protocol, they will treat you. Usually the mild cases is using the antibiotic, which is the paracetamol. There is another question about using the ibuprofen, whether there is any problems that can adverse effect from using the ibuprofen. The NH has just say that there is no sufficient evidence that established that there is a link between the ibuprofen and the worsening of the symptoms in a COVID patient. But there is a link between the asthmatic patients and the ibuprofen. Usually the ibuprofen worsening the asthmatic person. So if the COVID patient is an asthmatic patient, it's not recommended to using the ibuprofen. Antibiotics, still there is no evidence that the antibiotics do much, but I think that the antibiotics are essential if you have a secondary bacterial infection. But this is my opinion. There's no recommendation by the WHO or the NHS to use the antibiotics in COVID-19. There is a lot of common questions other than this, but I will say this is enough for now. Abu Bakr, and let the people ask. Just to announce that I'm an ENT doctor, and I can help you from the ENT point. There's a lot of questions that I may not have an answer for it, but just excuse me for this. I can't like make a fatwa without the knowledge. This is in the Sharia knowledge as well as the medical knowledge as well.
So, Doctor, we have a question from our brother Yusuf, and he says, what advice can you give us to help us be more aware about our surroundings?
Does his question mean that the people around us, how we, from the medical point, or from what point? Sorry,
I'm not sure, but that's the question. Yeah. That's what he said. He said medical. Is the medical point.
From the medical point of view, it just if you have your if you have an old father or mother, or if you have your granny with you, just be careful, because they are more vulnerable peoples. If they started to have any symptoms like a fever, cough, you need to get a medical advice. At least contact your GP first. Contact the COVID number, the 111 number. You can get the 999 as well if they started to get much trouble. This is the answer from what I can understand from the question.
Okay, thank you. So the second question is by Abu Abdurrahman. It says, does the infection give you immunity?
Oh, this is a good question. Yes and no. So there's two types of immunity. The first immunity thing is that when you get the infection and you've been cured, there is a level of antibodies called the IgM, which is stay in your blood for a couple of weeks to a couple of months. But there's another type of immunity called the solid immunity, which is the permanent immunity, which is the antibodies in your body will be changed to IgG, which is up to now. But there is a German study recently published yesterday said that there is only 14% of the people have shown that there is an IgG in their blood, but this is low, still not high ratio. So it doesn't give a solid immunity. Solid immunity, that's mean that when you get your vaccines, like the vaccine when you was child, they give you some vaccines against some viruses, like the rubella virus, the German measles virus, for example. This give you a solid immunity. That's mean your whole life you'll not get the German measles, for example.
Also, the brother asked again, does that mean there could be another wave of corona and it could be more dangerous?
Oh, the mutation. So that's mean the corona itself change. We have to know that the coronavirus is a big family, so there is like more than 200 type of it. What we what we know is a few of them. So we know the SARS-2, which is what we have, the MERS, which is in the Middle East, respiratory stress disease. So the virus can change. Yes, the virus can change and mutate. Hopefully, it can be weak or become more aggressive. This is upon the Rahmah of Allah. So what we have to do is to pray. So the science have, at that stage, there is a level of knowledge in science. Beyond this, we are believers. We have to know that we are believers. We believe that Allah subhanahu wa ta'ala is qadir. He can do anything. And this virus have attacked the human by the qadr, which is the order of Allah. This is clear. So we have to know this. So just pray and say Allah Rahim.
Shukran, Doctor. So the last question that we have is, what do you think about those Muslims who pass away infected by corona? And is it safe to perform ritual washing for them using a full PPE kit?
Okay. So back again. It's not me that make a fatwa. So what I think from what they have, there is hadith upon the Rasul have mentioned that al-mabtun, that's mean the person in the long hadith, al-mabtun wal-mahruq wal-hadam, all this means that it's the people who have died in burn, people who have died with the disease in his tummy, but this means that all of the disease are shaheed. So we may ask Allah that they died as a shaheed, and they give them the ajr of the shaheed. And may Allah forgive all of the people who have passed in this period and before as well, and all of our families that has been passed away. But from the ghusl, we don't think that any diseased person, died person, can transmit the virus, because it needs to be a droplet. That means he cannot cough, he cannot sneeze, but just be aware when you touching the nose, the face, or touching any other particular the special parts of his body. But I think the ghusl can be done, and there is a modification. In the NHS, they do a bit of a modification, which is like not a ghusl. It's like the tayammum. So they do it like a tayammum with using the PPE.
The question after that, inshallah, it says, do you think it is ethical for Oxford University to skip out animal testing for vaccines?
Oh yeah. So back again for this. What Oxford or the others do is they follow the steps that has been done before in generating the vaccines for virus. So this is, I'm not saying it's a routine. It's not a routine thing. It's a key step, but you can pass those key steps if you find it's a safe. What they used to do, they do this on an animal for 6 months at least, because they have to test it on the animal, see this whether the animal has got the infection, how's the levels of the IgE, which is the antibodies in the blood. But what they have done, they tested on an animals for a short time to make sure that it's a safe. So they passed the safety test, but not the efficacy test. So they pass it to the human to see the safety and the efficacy, which is the response.
Okay.
They didn't pass all of the animal tests. They pass only the safety part of it, because to see the efficacy, it's a very, very difficult thing.
Thank you, Doctor. Inshallah, that answers everyone's questions. And Barakallah Feek, Dr. Abdurrahman, we appreciate your time for giving us this advice. And inshallah, I will end it off by adding some information. So if anyone, oh sorry, we have another question. by our brother Imad. It says, can we help the infected people in our community?
So the infection with taking all of the
sorry. It says, can we help the affected people in our community?
So affected by mean they become a disease, or they're affected by have been affected socially or economically. So there's a lot of points, but from from the medical point, yes, you can help somebody who've got the COVID, but you need to take your precautions from taking the gloves, the mask. You can help them through getting them what they need from the food supplies, all of the supplies they would like to do, but with a very care steps, and they also be very cautious.
Yeah, we've got another question, and it says, is there any estimate time to get the life to normal within the upcoming days?
This is a political question. Sorry, I have to skip it, but from the religious part, just what we can do, just it's for me, I'm a believer, so I believe that ظهر الفساد في البر والبحر بما كسبت أيدي الناس. So that this is a type of the ibtila from Allah subhanahu wa ta'ala, maybe from our sins. We're not saying the other sins, our sins. So asking Allah for forgiveness. I think this will shorten out the period and makes the life back, and Allah subhanahu wa ta'ala have mentioned as well, وَلَوْ أَنَّ أَهْلَ الْقُرَىٰ آمَنُوا وَاتَّقَوْا لَفَتَحْنَا عَلَيْهِمْ بَرَكَاتٍ مِنَ السَّمَاءِ. This means if we are true believers and ask Allah in a truly believing way, Allah subhanahu wa ta'ala will forgive us and open the barakah upon us.
Okay, thank you. Just to tell everyone, if anyone has any more questions, please put it in the chat as soon as possible before we end. So
thanks, Abu. We Dr. Saib have mentioned it will be 30 minutes, so we passed the 30 minutes.
Okay, barakallah feek, shukran.
But so I think so there is also we have like a series of meetings on Thursday. Me or one of the doctor's brothers as well will be on the same time every week. So anyone have questions, they can put it to salam at Liverpool Ramadan.uk as well, and we can answer the questions, me or my colleagues, next week as well.
Barakallah feek, Doctor. As the doctor said, if anyone has any inquiries, any questions to ask, it's at email us at assalam at liverpoolramadan.uk. And to add on to that, as we are all in need of in help, the masajid are also in need in this pandemic. So we encourage you to donate by going to our website, which is Liverpool Ramadan program.uk, and inshallah you can all go and donate to our masajid, and inshallah it will increase our khair during this Ramadan. Also, as I said, please email us if anyone has any inquiries at assalam at liverpoolramadan.uk. And we thank everyone for coming again and joining us, and we thank Dr. Abdurrahman again for his advice and taking his time for giving us this advice. And barakallah feekum, and assalamu alaikum wa rahmatullahi wa barakatuh.